Good morning, everybody. This is Dr. Miller. Welcome to Tuesday Health Tips. Today, we're going to be talking about diabetes. And, diabetes is one of my passions. I've been helping diabetics resolve their health conditions for such a long time. And I've lost both my grandparents to type 2 diabetes. And, I firmly believe that if I knew what I knew now, when they were still alive, I know they'd still be here and living just a much better quality of life than they did in their end of the years. And, with type 2 diabetes, it is absolutely an epidemic in our country, especially on this side of the world where we live here in Kentucky. We're seeing more and more percentage of the population being diagnosed at a much younger and younger age. 20 years ago, we never saw teenagers being diagnosed with type 2 diabetes. And, that's happening nowadays. Hey, Dr. Patrick, how are you, sir? What's up, Dr. Pierce? Guys, so type 2 diabetes, I want to talk about what we typically see with the conventional approach, how our approach is just so much different, as well as our results. Typically what we see with type 2 diabetes is you're diagnosed on a routine office visit. So you go to your doctor for, an annual checkup, or you have the flu, you're getting a life insurance policy out for whatever reason. You go to your doctor and they run a basic blood panel. You return to that doctor for those results. The doctor sits you down and, you can already kind of tell he doesn't have anything good to say, right? And so he sits you down, and the way that my patients have told me how this process goes is before this doctor can even finish telling you that you've got this horrible disease process beginning inside your body, he's got his prescription pad out, his ink pen's clicked, and he proceeds to write you your first oral diabetic medication. Now, on that first visit, it will tell you to lose weight, exercise, and improve the way you eat. And that's pretty much the extent of the counseling that you get on that first visit. And those of you that have been dealing with diabetes, as you know, that's pretty much the extent of the counseling that you get throughout the disease process. And so let's say they started you off on 500 milligrams of metformin. Metformin is one of the most popular diabetic drugs in the world. And whether that helps to temporarily drive those glucose levels down in the near future, 3 or 6 months later, you'll return to that doctor for follow-up tests. Again, the same basic blood panel is ran. And sure enough, your doctor's not happy with your sugars. Your sugars are starting to go up. And so what does that doctor do? That's exactly right. That doctor then increases or maxes out the amount of that first medication. Now, typically what we see, because of the effects that high blood sugar has on the body, typically what we see in the first 3 to 6 months of being diagnosed with diabetes is we see some other lab markers or some other symptoms start to arise. And so we see things like blood pressure starting to go up, cholesterol starting to go up, triglycerides starting to go up. So with many of you, you go from no diagnosis and no medications in a very short period of time to 3 or 4 different medications. And this is a standard of care, folks. We see people coming into our office all the time that are on 2 to 3 oral diabetic medications, including insulin injections, 2 blood pressure medications, a cholesterol medication, a triglyceride medication, and then they give you a medication to protect your kidneys from all the medications, right? And we kind of laugh when we say that, but man, it is just absolutely the truth. And so what we see over time, because the standard of care with a type 2 diabetic in our country is you're going to get worse with time. What we see over time with the conventional approach is that you need more and more medication over time. You gain more and more weight. You have less and less energy. Overall, we just see diabetics in our country living just a much poorer quality of life than they should be. And it really agitates me, really irritates me when I see this, because the people in my community, they are sick for no darn good reason. And the reason why the standard of care is that you get worse with time is because, the medications are not designed to fix anything. The medications are not designed to resolve the diabetic condition. And so, the thing that we do differently is we ask the question, why? Why after 30, 40, 50 years did you all of a sudden lose control of your blood sugar? Because if we can just find out why you lost control of your blood sugar and restore that to normal function, then your body's going to be able to control its blood sugars again, and you won't need medication to suppress those symptoms. And so, what is it that's causing your type 2 diabetes? And the thing is, guys, it's different in every single one of you. There's not two diabetics watching this live feed right now that are diabetic for the same exact reason. So again, our motto in this office is we don't guess, we test. So we need to test you. I tell my patients, I'm going to test you upside down and inside out to find out exactly why you lost control of your glucose levels in your body, so that we can start to correct those underlying mechanisms, therefore reestablishing normal blood glucose levels in the body. And so, there's a couple places we need to look. Obviously, the pancreas is extremely important. The pancreas, the beta cells in the pancreas is what secretes the insulin. Insulin is the hormone that one of its jobs is to take the glucose from your blood and put it into the cells where the mitochondria can make ATP, one of the very, very important metabolic factors going on every second. And so obviously we need to test the pancreas, see what your insulin levels are doing, because typically what we see with those of you that are that are eating the typical American diet, you're getting huge glucose spikes. And so therefore you need a huge amount of insulin to try to get those glucose levels down. And when you have chronic high levels of insulin, what your body does over time is it develops what's called insulin resistance, right? Or type 2 diabetes. And so in those cases, the pancreas is doing its job. It's secreting the insulin. It's trying to get the sugar levels down. But because there's so much insulin levels floating around in the blood, your cells, the receptor sites, just start to resist that insulin. Therefore, your sugar starts to stay in the blood, your blood levels start to increase, and then you're diagnosed with diabetes and you get put on medications. Now, there are other things that cause diabetes. There are some instances where the pancreas will not have sufficient amounts of insulin. Therefore, you don't have the enough insulin there to reduce the glucose levels in the blood. Sometimes there's an autoimmune component, right? So when there's an autoimmune disease, meaning that your immune system, which is there to protect you and fight off foreign invaders, that system becomes aggressive against your own body. And so if it starts to attack the pancreas and the pancreas isn't able to secrete proper insulin levels, again, your sugar levels are going to start to go up. Thyroid function. We absolutely need to make sure your thyroid is functioning very well, especially in the diabetics, because the thyroid is the master control gland. The thyroid controls just about every metabolic function in the body. And a lot of times people that are dealing with diabetes, they're also dealing with either a low functioning thyroid, or the hormones aren't being utilized properly or activated properly in the body. Again, guys, we just need to test you to find out exactly why this disease has begun in your body. I don't care if you're diabetic, recently diagnosed, or if you've been a diabetic for 20 years on 200 units of insulin a day. We see it all in this office. We see people that are injecting themselves 5 times a day. We've even seen people come in with insulin pumps because they need insulin going into their body every hour. And with our approach and our treatments, we're able to get those people completely off those insulin pumps, completely off insulin, because again, our job is just to normalize function. See, the way God designed us is to function normally, but because of lifestyle, because of diet, because of the things that we do to our body, we start to cause dysfunction. The dysfunction leads to symptoms. Now with type 2 diabetes, high blood sugar is one of the main symptoms, but if you just focus on the symptom of high blood sugar, like the medications do, again, you are just gonna get worse with time. Now, a couple things that we need to address when it comes to diabetes is the triggers. So yes, we need to look at the thyroid. We need to look at the pancreas. Excuse me, the phone's ringing there, but we need to look at the liver, right? We need to look at the GI tract. We need to look at how you're digesting your foods, how you're breaking down your nutrients. And so when it comes to diet, guys, again, there is no one diet. And this is the thing with type 2 diabetics. Because you're not getting a lot of coaching, you're not getting a lot of help from your current physicians, what do? Well, you go do a lot of research, right? You go home, you go Google, and you Google diabetic diet. Hundreds of diets are going to come up, and they're all going to contradict each other. And so what do most diabetics do? Oh, they say the heck with it. I can't, all these diets are contradicting each other. I just don't know what to do. And so, listen, guys, we need to test to find out how food is interacting with your physiology, okay? A typical diabetic meal of, say, we're doing steamed broccoli, and grilled chicken. You would think, man, that the broccoli's got a ton of nutrients in it. The chicken, that good animal protein to help stabilize your blood sugars. But if you have a sensitivity or an allergy towards those foods, When you eat those foods, your body sees them as a foreign invader and not as nutrition. Therefore, inflammatory processes are going to begin. The end result is you're going to get a higher blood sugar reading. And so again, guys, I'll say it again. We don't guess, we test. We need to find out what foods you can and cannot eat so that we can formulate a customized diet based off of what you need to be healthy. Guys, the testing we do is just phenomenal. For those of you watching this video, you have diabetics in the family, friends that are diabetic. Please share this video for them. Go find a Wellness Way clinic or come to us here in Lexington. We love getting people well. We love just giving you your life back, because I know diabetics, that once you reach the complications of the disease, because here's the deal, most of you diabetics, what we've seen over the years is you live in fear, because most diabetics, you have loved ones around you, whether it's your brothers and sisters, mom, dad, aunts, uncles, but most diabetics have loved ones around them that they've seen go through that diabetic journey that I just spoke about. They've seen them go from one medication to another, eventually leading to insulin injections. They see them gaining more and more weight, having less and less energy. Overall, again, just living a very poor quality of life. And then they see their loved ones reach the complications of the disease. They see them having open heart surgeries and strokes and heart attacks. They see them losing limbs to neuropathy, going on dialysis because their kidneys are shutting down, going blind due to retinal neuropathies. Must I go on, right? And so they see themselves trending in that same direction. So of course you're fearful. And so if you did get to a point and you stood up and you said, listen, I know I need to do something different. I know what I'm doing is not working. 5 years ago, I was just diagnosed. Now I'm on 10 different medications. I know that I need to do something different. See, if most of you went to your physician and said, doc, listen, I'm to the point in life where my health is my number one priority. I will do whatever it takes to reverse this disease process. Doc, just tell me what I need to do. And guys, I'll be honest with you, most of your physicians, maybe not all of them, but most of your physicians will look at you in the eye and tell you that that's not possible. They will tell you the best that you can do is continue to take the medications to slow down the inevitable progression of this chronic degenerative disease process. And that is the best that you can do. And guys, if you get just one thing from this video, hopefully you got a lot out of this, but if you only get one thing, it's the fact that that is just absolutely not true, guys. When you address the dysfunction properly, when you unravel the underlying triggers, when you reestablish normal function to the body, it is absolutely possible to completely walk away from the disease process. We have helped hundreds and hundreds and hundreds of patients do that. Rarely do we see a diabetic fail in our process. And again, it's just because we're getting down, we're finding out what the causes are, we're finding out what the triggers are, we're reestablishing normal function. And guys, when our body functions normal, we don't have symptoms. High blood sugar is just a symptom of your body not functioning correctly. So guys, I hope you got something out of this. For those of you, again, that have diabetics in the family or friends, please share this video to them. I want to give them hope, because at the end of the day, most diabetics have just lost hope. They're so sick and tired of being sick and tired. They're so sick of all the medications. They're so sick of being browbeat to lose weight and exercise, and they can't. And so guys, I want to be a breath of fresh air to those people. I want to help those people reestablish just normal function and get their life back, because a lot of these people are retired and wanting to enjoy their golden years, enjoy time with their grandkids and their kids, and they're just not able to because of their health. And again, guys, we are here, Wellness Way in Lexington, Kentucky, at Mill Pond Integrative Health and Wellness. We're here in the Mill Pond, Boston Road, Kroger Shopping Center. Call us at 859-219-0617. Get scheduled with myself or Dr. Shannon Pierce as soon as possible, so that we can help you get your life back and help restore health and normal function. God bless. We'll see you guys next Tuesday at our Tuesday Health Tips. Have a great week.